Hi, I'm Dave Lingerfeld. I wanted to provide a quick little overview on some of the data that we've been seeing come out of COVID-19, but more specifically within the state of Missouri. I've had several requests for this, so I wanted to take some time to just break it down for you on what I've seen based on current data. A few disclaimers first, though. I do work as a healthcare data scientist at a university. The thoughts I'm sharing with you are the result of my own research. It's not a university sanctioned project, nor does it express the opinions of my employer. I am not a medical doctor. There's no political interest or motivation behind this. And at the time of the recording, this data is current from credible sources. I'll share the links to these recordings down below for you to reference as well. Just keep in mind they do change frequently. First, before I get started, most importantly, I want to send a big shout out to all of our essential workers, our healthcare providers, and everyone out there keeping the lights on as we work through this. These are certainly unprecedented times, and I owe every one of you a cocktail when all this is over with. So thank you for all you do, and stay safe out there. So the current data we're looking at now supports the fact that COVID-19 cases have peaked nationally as well as within our state of Missouri. What's interesting is while you turn on the news and you hear a constant barrage of negativity around the number of cases and the number of deaths, it's important to know one thing has kind of been left out. Down below you see these were the current numbers for the week when COVID-19 peaked in terms of the death rate. So as you can see, heart disease still wins out. Not by much, but we still lost more people last week to heart disease than we did to COVID-19. And as you can see, cancer comes in third. This is really troubling to me, as how great would it be if suddenly as many people as were upset over COVID-19 got upset over heart disease and started making healthy life choices and working towards a better lifestyle to dramatically reduce the amount of deaths due to heart disease, which, as you know, in most cases doesn't require hospitalization or ICU beds or ventilators or that sort of thing. So when we got the early projections for COVID-19 in March, businesses started to close within the state, schools shut down, moved to online. It created a ton of churn within the state, as it did with other states. It was a national issue and concern and still continues to be. Those early projections had the state of Missouri at roughly 1,700 deaths as a result of COVID-19. So this created a statewide death rate of 0.027%. Now, I got to this number based upon the reported population in Missouri at 6.137 million. Now, again, full disclosure, there are a few different data sources that will give you some varying numbers in terms of what the population within the state is. This was the number that I used. With that, the early estimates that were the big number of 1,700 deaths still predicted that in the state we would have no shortage of hospital beds, no shortage of ventilators. But again, we still panicked. You couldn't find toilet paper. Still don't understand the logic behind that. If anyone has data on that, I would love to see how a respiratory virus creates a high demand for toilet paper. But that's probably another presentation for later. So as time passed, we started to look at better projections and realized we were off quite a bit with some of this. So new numbers were reported, models get updated, and we noticed a significant number reduction in both cases and fatalities, but yet we still saw stay-at-home orders get extended. The updated projections within the state showed a total of 362 projected deaths statewide. Okay? Using that same population number for the state that I showed in the prior slide, this gave us a death rate of 0.0058%. At the time of this recording, 129 of those deaths have already occurred in St. Louis and surrounding areas. What's interesting is when you crunch the numbers on this statewide, this is similar to the fatality rate of drunk driving in this fatalities due to drunk driving in the state of Missouri. So what I want to do now is hop out to a few of these data sources that I use. So this first one here comes from Johns Hopkins University, and this one is updated very real time. So this will change as you come back and reflect upon it, but it shows not only by country, you can drill down by state, and here I've got it zoomed in, looking within the state of Missouri, and you can see how we're impacted. You can see St. Louis over here, and it'll update the numbers. It's showing St. Louis is 2 different, and then into the Kansas City area as well, which those 2 cities represent a bulk of the cases that we see. Now, what's interesting is, and I've had this question come up a lot over the last 2 weeks, and that is, why does the state of New York have such a high positive rate? And the easy answer a lot of people default to is high population density. They rely a lot on mass transportation, all of those things. There's definitely some credibility to that, but here's what I want to call your attention to. Look how many people they've tested. They've tested over 600,000 people in the state of New York. That's one of the highest density rates of testing that we've seen. Okay. Notice the second one is California, which is not even 300,000 yet. So they tested at a very high rate. And what's important to note about that is we don't really have a lot of good data around being able to test an entire geography or an entire population. One example we have, and full disclaimer, I won't say this is a representative population, but remember the Diamond Princess cruise ship, one of the first cases of this showing up? And there was a lot of discussion over what do we do? Well, they tested every single person on that cruise ship, passenger and crew. And look, it resulted in 18% of the population testing positive that shown no symptoms at all whatsoever. So it's important to note, as we ramp up our testing concentration, we're going to see the number of positives increase as well. So again, we have a lot of people that are carrying this that exhibit no symptoms at all. They recover from it. And the important thing is they also are going to carry the antibody for that as well. The other data set I used as I crunched the numbers on this was this dashboard as well. Again, full disclosure, at the time of this recording, the last update date was April 17th. It'll update every few days. So this shows, again, some of the dates around businesses closing. Again, at the time of the recording, it says we're 7 days past the peak in projected deaths. This is what we typically look for, is we look at an increase and then we look for a drop. And it is pretty common to see a slight increase again when you talk about viral spread or pandemic spread. This is pretty common behavior. What's really interesting to look at is the resource utilization. So here we can see, here's the number of beds we need and the number of ICU beds needed, and then the availability of those beds. So we have plenty, there's more than a surplus. And part of this is due to the planning efforts of healthcare workers and administrators in this space. I've been made aware of several, I know in my city, that have repurposed hospital rooms into ICU isolation rooms to prepare for this. The good news is we're not going to end up needing very many of them. So then again, it comes down here and it's tracking what the total projected death count will be. And that's where that 362 number came from that I shared earlier. So again, thank you for your time. Feel free to comment below. I've shared the resources as well that I used to construct this presentation. And based on any comments, I can create additional presentations that continue to get into the numbers as we see this evolve. Thank you.